talk a little bit about being a startup and what it takes to go from selling that first fax machine to actually being a platform that's experiencing network effects. I mean, that in and of itself is almost a unicorn in healthcare, isn't it?
Yeah. It there are not many platforms that have scaled in healthcare. I think SureScripts is probably the best example of one that's actually reached kind of a critical mass moment. But if you look at platforms like Uber and eBay and Amazon, kind of in the non-healthcare space, in the consumer space, you can reach network effects faster because consumers have word of mouth. They shop based on convenience. Best product wins, best price wins. You can differentiate on those factors. In healthcare, because of the enterprise B2B sale that you typically have to get into, it becomes a lot harder to reach sort of ubiquity and create the platform network effect experiences that a lot of non-healthcare companies create. And that's largely because in healthcare, the people that are benefiting from your product are usually never the ones who are paying for your product. So you have to convince multiple people across the organization to say yes. And there's probably 100 people at a big healthcare organization that have to say yes. And if any one of those people says no, then it can kill your deal. And so that is a huge challenge for startups as they're trying to build something in the healthcare space is how do you actually make a sale into a health system without sinking 2 years of time and effort in the sales cycle to get it live? And do you have enough funding to actually get through that process to get your product validated and start generating revenue before you run out of money yourself and have to go under? I think that's one of the hardest challenges for health tech companies. With Redox, what we do is we just try to, there's a lot of barriers in place. We try to remove one of them, which is when you get to IT and IT asks, how are you going to integrate? Can you handle HL7? Can you handle Fire? Can you handle whatever standard they throw at you? You can confidently say yes and give them the plan on exactly how that happens. That's what we work with our customers on. And so we try to reduce that barrier. We help them with security concerns, things like that. But we're not going to help vendors with their value proposition. They still have to make that sale to a health system. They still have to convince their clinical users and administrative stakeholders that their product is worth buying. But hopefully when they get to IT, they're working with Redox, that process can go smoothly from that point on.